Governor Sununu, the state recently announced plans to reimagine its treatment and recovery model around opioids. But in the last year, the state has seen a wave of recovery center closures, some patchy funding at the state level, and uncertain outcomes in some cases for those who rely on those kinds of services. What makes you think this new change in direction will yield better results?
Well, we are taking a drastic change in direction in terms of how we attack the opioid crisis in this state. It starts with, there's a bunch of different pieces here that we really have to be part of the puzzle. The hub and spoke model that I've created really provides access in the rural areas, a barrier that we just hadn't been addressed in so long, so people can get not just treatment and recovery, but those full wraparound services of job placement, recovery housing, MAT, all of these pieces. And we have data now that will actually work with individuals to make sure that they're not falling off the system, they're not relapsing. I invented recovery-friendly workplaces to make sure that the workplace is part of that solution. We've tripled the amount of money into the alcohol fund, and we've done it with a private partnership with the hospitals, which is an enormous opportunity in terms of the funding aspect of it. We went down to Washington, D.C., and we made a case. We said, if you invest in New Hampshire, you allow us to recreate the entire infrastructure of this state. We don't have the bureaucracy. We get results. We can track the data. And already, for the first time in years, we're seeing overdoses and deaths go down in this state. We have a long way to go, to be sure. But this new model, this tangible model, can really provide access to services that previously were not there.
Senator Kelly, on day one, what specific thing will you do differently? And again, we're looking for a concrete policy that you plan to take if elected.
Well, I think it's always hard to say one thing. I will just tell you, on the first day that I'm in office as governor, I will make sure that every child in the classroom is not hungry and has had breakfast. And we can do that. We can pour all the money that we want into education, but if our children are hungry in schools, they won't learn. So that's number one. The other is this opiate epidemic is a crisis. It is an epidemic, and we must address it. There is not a family in this state who has not been affected by this epidemic and continues not to be. So we do need to address it, and I would put forth an emergency plan to address the issue of treatment, prevention, and recovery, and to make sure that the children who are the real victims of this disease as well are supported, and their caregivers as well. The program that my opponent is talking about was a program that was put together not by bringing everyone to the table at the beginning, but a program that was put forth to be implemented. And we know that there are hospitals here in Manchester and also in Nashua who are not a part of this plan to move forward. So I would put a plan together.
Governor Sununu, you were invoked. You get 30 seconds.
The hub and spoke model is based with hospitals in the background. We asked hospitals all across the state. The hospitals in Manchester and Nashua chose not to participate, but that's okay. We have Granite Pathways, a great organization that can provide that. But let's be very clear. My opponent was just asked to give any specifics, even just one, on how she would deal with the opioid crisis. Nothing. Not a single concrete answer. She was asked about fuel. Nothing. She was asked about the economy. Nothing. They asked about student debt. I've yet to hear a single idea about where we need to go, what we need to implement. You have to understand how these systems work to know how they're going to be implemented. And again, it's all about just getting the best results for the people in New Hampshire.
Senator Kelly, you can respond.
Yes, I would like to respond to that. I was a state senator for 10 years. I got things done, and I know how to get things done. So my opponent is not correct. I have put legislation together with many, many details. My opiate plan does have a detail as well, as I talked about. I was the first senator to put forth a renewable energy group net metering bill that has made a real difference in the state. I know how to put legislation together. I know the details. I know how it works. And I will just tell you that if there is a piece of legislation.
Senator, that's time.